If you're looking for a more attractive smile, you may want to consider cosmetic dentistry. From bonding, crowns, and veneers, there's a wide range of options. I recently sat down with Dr. John Kent at Partners in Dental Health to get more information. So, Dr. Kent, what is exactly cosmetic dentistry?
All right, cosmetic dentistry, one of my favorite topics. Well, first of all, before I talk about cosmetic dentistry, I want to talk about what it takes to be a good dentist. There's two ways you can be a really good dentist. The first way is to be a technician. And so what that means is that when you do your work, all your measurements are perfect, angles are perfect, you take out the cavity, everything's just technically sound. And when you have a filling put in, it'll probably last you a really long time. And so the thing is that you can have the most technically sound filling, but it doesn't mean it's pretty. The second way is to be an artist. So if you're a good artistic dentist, all your work is beautiful, like the shade matches perfectly. Basically the work looks invisible. You can't tell it's work at all. In order to be a good cosmetic dentist, I believe you have to be good at both of those things. You have to be both an artist and a technician. So to answer your question about cosmetic dentistry, I think a good cosmetic dentist, you have to customize your work for the patient. It usually includes the front 6 to 8 teeth, either top or bottom. It just depends on the situation. And the dentist is able to make the work look invisible so that no one can tell that it's cosmetic work at all. It just looks natural.
What are some ways that you can improve someone's smile?
Oh, okay. So the first way is the simplest, whitening. Sometimes your teeth look really good. It's just the shade of the teeth you don't like. Maybe everything, you had braces and you just want to brighten up your smile, whitening's the thing for you. A step up from whitening would be veneers or crowns, and again, it just depends on the situation. But basically what those are, a veneer is something that covers the front of the teeth. A crown is something that covers the entire tooth. So if it's more than just shade that's bothering you with your smile, maybe shape, maybe one tooth is a little bit longer or a little bit shorter, maybe you have some spaces here and there, then veneers and crowns are the thing for you.
Okay, we have some before and after pictures. Please explain what we're seeing here.
Okay. This patient was missing a front tooth and she hated wearing her removable flipper. So we fixed her smile for bridge and you can see how beautiful and natural you can make it look. Now on our next case here, this was a really fun case that the patient was very happy with. He hated everything about his smile, and I'm sure you can see why. You would think that you would need to fix every tooth in his mouth by looking at the picture, but look what kind of results you can get with just doing the front 6 teeth. And on this last case here, this is a patient who had very short teeth with a lot of spaces in between. So she needed to get a minor surgical procedure called aesthetic crown lengthening and braces, and then she had her front 6 teeth done. So she's eventually planning on doing the rest of her teeth, but you can see how big of a difference just getting the front 6 done are.
So you can really do a lot with a little, Dr. Kent. Thank you so much for joining us today on the Hampton Roads Show.
Thanks, I appreciate it, Chris. Thanks for stopping by our office.
It really is amazing what they can do with the average person's mouth. And if you need a checkup scheduled, contact the Partners in Dental Health at 499-2100 or log on to partnersindentalhealth.com. Thank you so much, Dr. John Kent.
Some good stuff there.